Hello, everyone, and thanks for listening to today's Campus Safety Voices podcast on K-12 student and teacher mental health. My name is Amy Rock, and I am Campus Safety Senior Editor. For today's episode, I chatted with Kati Garner, who is a training consultant for the Colorado School Safety Resource Center. And Kati has a unique perspective because in her role, she consults with and trains school staff on their students' specific safety needs. So she is hearing firsthand the struggles K-12 schools are having with addressing mental health. In our interview, we did speak about ways mental health concerns have increased and evolved for both students and teachers during the pandemic, but we also talked about common indicators that someone is having a mental health crisis, strategies staff can use to de-escalate kids in a crisis, and for themselves, how staff can tell the difference between typical stress and burnout that comes with the territory of working in education and actual traumatic stress. Kati also provided information on how to access free available programs and resources to address mental health concerns. Take a listen. Be sure to subscribe to Campus Safety's YouTube channel and like or leave a comment on our videos. Or subscribe to our Campus Safety Voices podcast on Apple and Spotify and leave a review. You can start off by going over what the Colorado School Safety Center is and does, and then also a little on your background and what your current role is within the center.
Yeah, so the Colorado School Safety Resource Center was really set up to help schools within Colorado with their psychological safety needs as well as their physical safety needs. So we help schools with pretty much any sort of safety type issues that they may need, ranging from behavioral threat assessment to suicide risk assessment. We train and help support them in, as well as things like restorative practices, bullying, policy and procedure when it comes to crisis and crisis response. So we're really a free resource through the state that comes out to schools and trains with them and consults with them based on whatever their safety concerns may be. My role within the center is I am actually the Northwest Regional Training Consultant. So our main office is located in Denver through the state, through the Colorado Department of Public Safety. However, we were given permission to hire 4 regional training consultants throughout the state. Unfortunately, I'm the only one left, but I'm in Fruita. So I'm on the western slope outside of Grand Junction. And so I really service the schools on the entire western slope of Colorado, and it gives me a unique perspective. I don't live in Denver. I live within the community. So when rural schools call me, I'm not looking at it from a Denver perspective. I'm looking at it from I live within a small community myself perspective. So that way it gives me the ability to be a little more creative while using best practices to help support the schools within my region.
Okay. Now, obviously with the pandemic, your job was changed in a lot of ways, not being able to be in person with these.
Yeah, so we've done a lot of shift to remote learning. So it's given me the opportunity to work with a lot of schools across the whole state that I may not have been able to work with in the first place, which is pretty cool.
Yeah, that's good. That's a silver lining.
Mm-hmm.
And so obviously mental health is always important, but it's been at the forefront since the pandemic. And I think when a lot of people think of mental health, they think of it affecting adults. And so some might not be aware of its prevalence, among school age children, very young. And can you speak to this a bit, and also maybe the changes you've noticed in its prevalence as we continue to live through and I guess somewhat recover from this pandemic?
Yeah, I think what's interesting is when we talk about recovery, it's more of shifting to a new normal and being more creative within the mental health space. And I think COVID has definitely shed a light onto a problem that has been pretty prevalent, but maybe not had as bright of a spotlight on it. So I'm a glass half full gal. So I think that it has definitely shown where we have some areas of improvement we need to work on. Mental health issues or concerns within youth are extremely common, and people don't realize that. I mean, even according to the CDC, 1 in 6 kids ages 2 to 8, so 2 to 8 are going to have some sort of mental health diagnosis or behavioral health diagnosis. And so I think it's important to recognize that the prevalence is common. And so just like when we're sick, we go to the doctor, we need to make it common practice that when we are struggling with mental health concerns, we go to the doctor. And the pandemic has definitely helped, I think, spread and shed a lot of light onto that. What we're seeing with the pandemic is just like with adults, when we had kids that were in isolation, also when we saw adults struggling, adults didn't necessarily have the capacity to support children in the way that they needed to be supported because they were dealing with their own issues and concerns around the pandemic. And so what we're seeing is really high rates, or not necessarily high rates, but increased rates of schools doing suicide risk assessments, and schools doing just seeing kids that are in crisis with mental health concerns. And I think that speaks a lot to the pandemic not only affecting our adults, but are affecting our youth as well. So this is not just an adult issue, this is a lifespan issue. So how do we provide those resources for everyone?
Yeah, it's so interesting to see the difference among generations in just like talking about mental health. Like in your role, you must love how open, college age kids might be about their mental health, and like, oh, you see these memes like, I told my therapist this, and it'll be so interesting to see how, this generation, how their kids handle mental health issues, because it's just like so much more spoken about.
Yeah, and that's really the goal, is that we want mental health to be a common conversation. It's nothing to shy away from. Just like I said, if you cut your hand and you're bleeding, you go to the doctor. Just because we can't see what's going on with someone and how they're thinking and feeling doesn't mean that it's not there and prevalent, and that we're not seeing those behaviors in other ways. So we need to get them the help and assistance that they need. And there's no shame or blame or anything negative around that. And so it's interesting to see, the more we talk about mental health with our younger students, the more open they are to that conversation. And we're starting to see that shift in, some of our middle school and high school students that have had these conversations since they were little.
And now obviously everyone's mental health issues, they handle it differently, or it presents itself, might be same diagnosis for one person, it presents itself totally different than another. But have you noticed if issues among this younger age, K through 12, have been presenting themselves in different ways since the pandemic?
I think what's interesting that we really have to pay attention to, and I always tell schools this, I tell parents this, pretty much anyone I'm training, is it's really, what is the change in your child's baseline of behavior? What is abnormal for your child? If your child, depression doesn't manifest the same way in everyone. We have this textbook kind of image of depression being, I'm sad, I stay in bed all day, maybe I overeat or I don't eat at all, I drop out of activities, I want to be left alone. But the reality is, for some students, that could be their baseline behavior. So a shift in their baseline may be they're angry. We're seeing increased anger in students. So something that may not have push them to anger before is now making them extremely angry. We may see that they're not sleeping at all. So they're attached to their phones all the time with social media and things like that, and they're not sleeping at all. Or we may see an increase or decrease in their eating. So it's really a shift in what is your child's baseline of behavior. And I always tell staff and students and teachers, pay attention to those. If your gut says that there's a change in that baseline, then that is an opening for a conversation. It doesn't necessarily mean that something's wrong, but what a great opportunity to have a conversation and say, I've noticed that you've been sleeping a lot more lately, or I've noticed that you've been really quick to anger lately. Talk to me about what's going on.
Yeah, and I think another great thing about the discussion of mental health being more commonplace is people are, like you said, have a perception of what someone who has depression looks like, or what someone, and if you're openly speaking about your struggles, then people's views are going to completely change, and it's not going to be like a one size fits all. Like, for example, my husband's family, he has a cousin who has schizophrenia, and I think people have in their mind this view of someone who has that, and I had never met someone with that disorder, and meeting him, I was like, wow, I really had no idea. Like, I guess you could consider his mild, where like you would have no idea if it hadn't been discussed within the family. And I just think it could help remove the stigma of any type of mental or behavioral issue.
Well, and you speak to an important part there, which is it's treatable. Everything is treatable. And so it's about finding the right treatment plan for that person. And it may take time. And that's something else that people get frustrated with, is finding the right treatment may take time, and recognizing that not all two counselors are alike, and there may be one that you fit better with. So don't get discouraged. It's about finding the right treatment plan that works perfectly for you. And that may be a combination of several different things, and really ironing out what works best for you specifically.
And now that most schools have returned to some form of in-person learning, what have they shared, schools that you've worked with, what have they shared with you are their biggest concerns regarding student mental health?
What we're seeing is a capacity issue. So we're seeing that teachers are overstretched. We are still seeing teachers that are having to leave the classroom because of, getting COVID or being COVID positive. So then we're having a shortage of substitutes and things like that. And then in general, we have an overall shortage of mental health professionals within the field. We have a shortage of mental health professionals within community practice settings, within private practices, and we have a shortage within schools. I'm not sure people are really aware of just how short schools are. There are a lot of, there are set ratios that the American School Counseling Association recommends, counselor to student ratios, and those are way over capacity. We have ratios in terms of school psychologists to student ratios, and those are over capacity. And then we have some schools that don't have any of those things. A lot of our rural districts don't even have a school counselor on hand. It's not in the budget, or it's not even possible. And so the capacity to handle the increased mental health concerns that we're seeing is just not there right now. And that is definitely putting a strain on our teachers. And it's kind of a cyclical effect of how that starts to impact everyone.
Okay. It's so tough, because obviously there's not, like you said, in rural districts, it's different than, in an urban district and their access to resources. Like, have you found, and it's not a one size fits all, but schools that, for instance, the last couple of weeks with this variant just spreading everyone so thin, like, what are some schools doing or relying on to help them fill those gaps in some way? I mean, maybe not necessarily, someone who specializes in mental health, but, someone who can sit in a classroom and monitor a classroom so that there's space for someone who's a professional to come in. Or
I'm finding that schools are kind of at a loss right now. Teachers are filling in as substitutes during their planned periods. Paraprofessionals, which usually help, with special education, are sometimes being called on to do other things. We don't have a number of substitutes, so the teacher stress is a whole separate issue than the mental health stress that our students are under, and the lack of support that they have. I think that we're going to have to get really creative. I've seen some communities that are doing a great job in terms of relying heavily on their local community mental health resources. So making a strong relationship and connection with local community mental health, so that when there is a strain or when they are strapped, they can have those partners or partnerships come in and help support. We do have BOCES, which are regional mental health through the districts, that the districts kind of hire. But the BOCES are just as strapped. So it's really about making sure that districts have policies and procedures, memorandums of understanding with community agencies, so that when they do get strapped for those resources, they have someone to call on. Because in the moment when you need someone, that's not when you want to formulate a plan. So really trying to formulate that plan ahead of time and know what are my resources if we get to this point where I don't have any more resources available.
Yeah, obviously right now it's like completely unprecedented with everything going on. And I mean, we were talking about silver linings, but going through this, in next year, in the next couple of months, if something like this happens again, hopefully schools are, taking notes and what works and what doesn't. And so that when this happens again, then they'll be more prepared. So I guess at least, it helps from a planning perspective to go through something so tough.
Yeah, and I think unfortunately what happened is, and it's no one's fault, there is no blame here. These are unprecedented times. And I think unfortunately, to some extent, what happened was a lot of unrealistic expectations. I think people thought, we're going back to in-person learning, it's going to be a normal school year. But what people didn't realize was, you're going back to in-person learning and we're still in a pandemic. And so from the top down, you had district administrators that wanted to get back on the curriculum train of, our students have missed a year of in-person learning. So we have this curriculum we need to catch up on. We had teachers that wanted to fulfill that promise of that curriculum, but then you had students that were really happy to be back in person, had also missed a year of in-person curriculum, and also were dealing with some pretty serious stuff, while forgetting that the staff had dealt with some pretty serious stuff. So as you have these compounding unrealistic expectations, none of the expectations are met because you can't meet them. And as a result, we ended up having some mental health outcomes, some unhealthy mental health outcomes because of these unmet expectations. And so we kind of saw that as a trickle down effect from the top down, where you have administrators saying, why can't we get this curriculum going? Teachers saying, we're trying to keep it going as best as we can. And kids that just want things to go back to normal, but are struggling with some real mental health concerns.
Yeah, it's just so complicated. Like, people are trying to do what's in the best interest, but what's best interest for someone, one kid who, it helps them if they're focused on a curriculum and being in school and a distraction from other things, and another kid needs support, emotionally versus curriculum. And obviously, I just feel awful for anyone who's in these positions. And then it's also like states are having to, like in Massachusetts, I'm in Massachusetts and we do MCAS, and it's like, how are these state leaders deciding, okay, we're not gonna, count MCAS scores? And it's just an insane time.
Yeah. And again, it goes back to that trickle down of unrealistic expectations. And so how do we even the playing field to manageable expectations, not setting the bar too low, but manageable expectations where we're still meeting the kids where they're at and meeting the teachers where they're at, teaching the curriculum we need to teach while also meeting the social emotional needs of our students. So then we don't burn out our teachers and we don't see the kind of behavioral and mental health concerns we're seeing within our students.
So with your training with the center, you talk about de-escalating kids that are having mental health crises. Do you have some strategies? Obviously, again, we could talk about this for hours, but some strategies staff can use to help de-escalate children that are having a mental health crisis?
Yeah, of course. So the first thing you want to do, of course, is be genuine. Make sure you're present with them in the moment. So you want to make sure that they are your priority, that you are focused on them, and you are just genuinely listening with them in the moment. It's a scary process for them to be going through that. It's scary for them in such a vulnerable moment for them to be sharing that information. So think of it as kind of a grateful moment of they are trusting you enough to give you that information. Even if it's coming across as angry, it means they trust you. So take that information very genuinely and honestly. The other thing is recognize what skills you have and you don't have. And it's okay to say, I don't have the skills to help this person where they currently are. It's kind of like CPR. You know, if you don't know the steps to CPR, it's okay. There's no shame in that. It's about getting them to the proper resources. So being present with them, being genuine with them, reassuring them that you're with them, and then getting them to the proper mental health resources so that they can get whatever it is that they need. Of course, making sure that we're maintaining safety. So if there's any sort of safety concerns within those moments, we want to make sure that any sort of weapons or anything, we want to secure that first and foremost and make sure that they are safe and that you are safe, and then get them to the proper people that can help assist them.
We were saying how mental health issues present themselves differently with everyone. How can you tell if someone is actually in what would be called a crisis?
Ask them.
Okay.
And a lot of that has to do with being genuine and building rapport with them. We don't want to jump right in and first question say, hey, are you in a mental health crisis? But really having a genuine, honest conversation with them using I statements. I can tell you're really struggling right now. I'm here to help you. How can I help you right now? Remembering that it's not our place to judge. Some of what they may express may come across as something we don't agree with or something we see as maybe not that big of a deal, but it's not our job to judge. So really being present in the moment and understanding them and ask them. If you are fearful that a student is contemplating suicide or thinking about suicide, it's okay to ask them, are you thinking about suicide? But also remember, if you're not comfortable doing that, it's okay, get them to someone who can. And there are some wonderful training courses out there that can help with that. I teach QPR, which is a gatekeeper training that really helps get people that are in crisis to help. Youth mental health first aid is amazing. The assist training. So look at your local communities because I promise you they are offering training to help you learn these different skills.
And obviously a lot of the focus is on students and their struggles, but obviously teacher and staff come in with their own, I don't want to use the word baggage, but like stress and not necessarily, diagnosed mental health issue but just like the stress of a pandemic. And how are you seeing teachers and staff's mental health affected since the pandemic?
Teachers are struggling at an all-time high right now. Teachers, I am extremely concerned about teachers' well-being and mental health. We already have a really hard time finding teachers to come into the career because it is a very underappreciated and underpaid job. And we are now seeing with the amount of tasks that they are being given and asks that they are being given, along with the pandemic and also the pressure from parents and school boards and everything else. Parents are at an all-time, or staff are at an all-time stress level. So I am definitely concerned. I am hearing from districts that I work with, as well as districts throughout Colorado, that their biggest concern right now is not only their students' mental health, but their staff's mental health. They're hanging on. And the other thing we need to understand is that there are healthy levels of stress, and then there are chronic levels of stress that can then also lead into other types of stress. So what we're seeing is our teachers are getting burnout. We're also seeing our teachers that are at a chronic level of stress. So their body is in that heightened state of stress for such a long period of time that they are unable to relax. The majority of teachers that I talked to said Christmas break was not long enough. They usually feel completely reset after Christmas break, and they didn't feel that after Christmas break. So we are seeing all-time high levels of chronic stress right now. And that's when we start to really worry about our staff, and also secondary traumatic stress, where they're starting to take on the stress of their students as their own, which can lead to a lot of really negative mental health outcomes, including things like PTSD.
And so how can you tell the difference between typical stress in burnout that's natural in a position as a teacher and then actual traumatic stress?
Yeah, so that normal stress, that typical stress is the stress that we're used to feeling. That's that stress before like a big game or an event or an assignment is due. And we have just that feeling of kind of giddiness. And then when the event is over, we feel much better. And it's kind of that feeling that catapults us forward to get that assignment done or whatever it is. When we're talking about burnout is really our staff that's looking at not having adequate resources, not having adequate support, not having the time to really deal with those different things. And so what happens over a period of time is they start to get into this phase of burnout. So it's really this feeling of our job isn't meeting our expectations because we don't have any of that support. So then when we get into that secondary traumatic stress, it's really that prolonged exposure to other people's stress, other people's traumatic stress, and we start to take it on as our own, and that starts to mimic PTSD. So we can actually start to see that happen within our staff. So toxic stress is that excessive, prolonged stress. It's way too much, kind of that Mach 10 high level of stress for way too long with way too little support. And I have found that over this school year, I have presented secondary traumatic stress to a ton of school staffs throughout the state of Colorado, because this is something that is definitely a high concern.
And it's so hard during the pandemic because I feel like a lot of the things that people typically do to like unwind from stress, whether it's go on a family vacation or like go grab drinks with your girlfriends, like people aren't doing that just with how bad the pandemic is. So I feel like typical outlets that used to be available for people to decompress just aren't there anymore.
Yeah, and my biggest thing is, why is it so hard as caregivers to practice what we preach? So teachers all the time are saying to their students, what do you do to unwind? What do you do to take care of yourself? But we kind of stink at doing it ourselves. I'm a former teacher, former school counselor, district administrator. I've run the gambit, and I can tell you it's hard to take care of yourself. And so with the pandemic, my suggestion has been to reconnect to things you forgot you loved. So for example, I love doing puzzles, and I forgot how much I love doing puzzles. So I bought a couple of the huge puzzles and dedicated a space and time. The other thing is blocking out time within your calendar for self-care. And I know that sounds silly, but we are creatures run by our iPhones And we are creatures run by our calendars. And if we don't block it out at this point, we're not going to do it. I also encourage staff members to block out time to get vitamin D, go outside. One of the little tricks that I learned along my career is to set your shoes by the door. This is going to sound so ridiculous. Set your shoes by the door and set a time in your calendar at 4 p.m. I'm going to go for a walk. And if you do not go for a walk, you have to apologize to your shoes verbally. So out loud, you have to say to your shoes, I am sorry, I'm not taking you for a walk today. And although that sounds silly, what it does is it gives us accountability. We're saying it out loud. It sounds ridiculous when you do it. And so what it does is triggers ourselves to say, are we really saying this out loud? Let's put the shoes on and go for a walk. So another one is if you have a dog, put the leash by the door and then look at your dog and say, I'm sorry, Percy, that's my dog. I'm not taking you for a walk today. And then look at that sad dog in the face. So just some of those self-care tips to get creative on how am I actually going to make time and space for myself.
I love those analogies. That's amazing.
They work. They're so silly, but they work. Yeah.
I also find like with me, I still have, I have a calendar on my phone too, but I still on my fridge, I'm looking at it right now. I have like a physical calendar that if I put something on it, I'm more likely to do it. It's like, if you want to go get your nails done, like make that appointment, put it on your calendar, and like you get into the habit of doing things that are on your calendar. And like you said, small little things, but kind of forcing yourself to do it. I love doing puzzles too. And I realized how old I'm getting when I start doing it because my back hurts after like 10 minutes. I'm like, what the heck?
Mine does too. But I think we forget, and especially educators put others' needs first. And so we have to reshift on how do I make myself a priority again? And that's really where it's at, because I'm such an analogy person, Amy, I'm so sorry. But it's really about that. There's a reason why on airplanes they say to put your oxygen mask on first. And so what we're finding is teachers who had good self-care plans prior to the pandemic are taking care of themselves and putting their oxygen masks on and are feeling okay. They're not feeling great, but they're feeling okay. And it's the teachers that did not have great self-care plans that are really struggling, because you have to put that oxygen mask on yourself before you can help anyone else.
I think analogies can seem corny, but I think they're very, very effective.
They're my favorite.
I feel like I have my shoes and my dog's leash near my door. And like for at least, the next couple of weeks, you just saying that to me, that's something that I'm going to think of. And, life gets in the way and then you forget about some things. But like if in that amount of time, that's an effective solution for someone to like do something that helps themselves. I think analogies are a great way to do that.
I think what schools have to realize is there's so much grant money out there that you have to get out there and just research. And it's not hard. Go to educational grant funding. A lot of local governments will have grant funding for mental health. Like Colorado specifically has a mental health professional grant that will help a school initially hire a mental health professional, and then the school budget then takes on that person. But really looking at, there's so much untapped federal and state money out there. Really make sure that you get out there and look at that money. And a lot of times districts will have a grant writer. And if you don't have a grant writer within your district, there are some really great one-day courses on how to write a grant. I worked in a rural district for a long time, and I took a one-day how to write a grant class and did that in order to get my school some funding for some stuff. So don't be afraid to take some of those courses and just get out there. The worst they can do is say no. That's what I always say. When it comes to funding, the worst they can do is say no.
And if they say no, at least you understand that process more, and then maybe you're more comfortable doing it again for a different time or a different resource.
Yeah, and the other thing I will say is that districts are driven by data. And so what is your data? How are you documenting your needs? How are you documenting what is your suicide risk assessment process? You should have a process. So what is your policy, procedure, and process? How are you assessing that? How are you documenting that process? And then what are you doing with that data? How are you using that data to leverage what you actually need within your district? Are you going to your school board and to your principal and saying, look at the increased numbers we're having. We do not have enough mental health support to carry the amount of suicide risk assessments we're having. How are you documenting the amount of kids that are coming in to your offices and that you're referring out to local community mental health? How are you using that data again to leverage I need more support within the building? So you really need to make sure that you have solidified processes around suicide risk assessment, threat assessment, so that you can really leverage that data to show your district just what is the need that we have within our district in order to justify that need. That's how we get FTEs. That's how we hire new teachers. We hire new teachers by saying we have an influx of 500 kids in the first grade. We don't have enough teachers. How are we going to cover this amongst the elementary schools? Well, that's how you should be justifying why you need more mental health. We've had this influx of suicide risk assessments and behavioral threat assessments. We don't have the need, or we don't have the coverage to be able to cover this. So how do we figure that out? That's how you leverage that data to get the FTEs that you need.
Now, aside from coverage and lack of staffing or staffing deficiencies with schools, I guess particularly in the last year, what are some of the roadblocks you found that they say that they're facing when trying to improve their mental health supports that they have in place?
There's still such a stigma around mental health. It's insane. I think that until we truly break the stigma around mental health, we're gonna have a lot of roadblocks. A lot of rural districts are still afraid to talk about suicide. A lot of districts are afraid of talking about social emotional, learning and education and suicide prevention and just general mental health needs with kids. And a lot of that boils down to, are we going to upset parents? Are we going to, and again, that comes back to there is still such a stigma around mental health. So one of the biggest roadblocks is really figuring out, how do we have this conversation? How do we help people realize that talking about it helps people? Talking about it makes people understand that they're not alone, that can lead to treatment, that can truly help people. One of the other big roadblocks I would say is learning how to partner with your local community health, community mental health. It can be a challenge to get out there and contact them and say, how do we partner? How do we set up a memorandum of understanding? Can we partner? That kind of stuff. And so from someone who's done it, don't be afraid, just get out there and don't be afraid to be told no, and then go talk to someone different. So you have to have a, I'm doing this for the kids attitude, and just keep at it.
When you said talking about it helps, it made me think of like how it almost needs to be treated as, someone who's going through cancer treatment. Speaking with someone else who has cancer is just like, it's from people that I know that have had cancer, they say it's just like so immensely helpful to like know that you're not alone going through it, and it needs to be seen in that type of light too. And I think discussions like this, and the more we put that out there, it's just gonna get us there, hopefully.
Yeah. There are still people out there that believe that if you ask someone, are you thinking about suicide, that it's going to put it in their head. And that's completely false. It's actually, if you're not going to put that thought in their head, it's a myth. And if they're already thinking about it, it's actually been shown to be a relief that you asked them. So again, really understanding mental health and not shying away from it.
And when I was researching questions to ask you for this, I read first article that popped up said, when there's population-wide trauma, like right now we're going through a pandemic or something like the 9/11 attack that, affected so many people, that it said that we have to heal socially, as in being together. And have you found that to be the case for school environments since the pandemic? Like, how much a difference have you seen going back to in-person learning has on student mental health?
Yeah, it does make a difference having people be together. There's a difference between we are human for a reason. We are social creatures. And so being able to reach out and hug someone is definitely different than virtually hugging someone. So I think what's hard is we are not only with the pandemic, but we are in such a socially divided time right now that it's really key that we come together and we figure out how do we do this together. And that means as a community, as parents supporting schools and schools supporting kids and teachers supporting parents and admins supporting kids and teachers and parents. So it is truly a community approach. And so how do we do this together?